Minnesota families without stable housing often lack access to preventive health care services. When these families do obtain services, they may feel judged and disrespected by the provider they meet with.
Where I lived when my children were young was central, rural Minnesota. We didn't usually even have a phone. So when I made those appointments, usually I would walk to the county building and use their phone. If I missed an appointment, it was usually a hassle to get back in to reschedule. When I eventually would get in for that appointment, the staff was kind of judgmental. There was usually a longer wait in the waiting room, waiting to get in. When my son was sick, the nurse that asked me, has he had a lot of emesis? I'd never heard that. And she said, projectile vomiting. I'm like, you could have just said that. I felt talked down to. It was angering, and it's unnecessary.
I got 2 medical appointments using medical transportation or friends or public transportation when I could, but my mental health and my sister died caused me not to ride public transportation. If I was to miss an appointment, they would do a no-show, and then when I tried to reschedule, they told me that I had to do same day. And with medical transportation, you can't do same day medical rides unless you are going to the ER. I would have to talk to like a supervisor or manager at the site just to tell them my daughter needs to be seen. When walking in late to an appointment, sometimes they would say, you people are always late. And that would make me feel very, very uncomfortable because looking like me in America, you already know what you people are. I really feel judged, unsafe. It makes me feel unwanted in a space that I truly need. It's just time for change fully.
Care providers throughout the state are working together so everyone has access to respectful, compassionate, and non-judgmental health care. When faced with similar scenarios, are your actions reinforcing or removing structural inequities? As a Minnesota healthcare provider, you can help lead the way and work to end discrimination and eliminate disparities. Help parents do what is best for their children and make every appointment a positive experience. Here are some key takeaways to remember. We know respectful, compassionate, non-judgmental care where everyone is treated with dignity and respect gets the best results and health outcomes. Be understanding. Reliable transportation is not always available for a variety of reasons. Think about creative ways to meet patients where they're at or offer more flexible appointments. Be aware of stigmas associated with healthcare. Lots of people have fears about even regular checkups, and these fears may be prominent in poor people or people of color. Participants may feel judged and distrustful of mandated reporters, such as healthcare providers. Unstable housing affects many people and families in different ways, including their attendance and behavior during their visit. Don't let their lack of housing influence the care you provide. Help do your part to make checkups a part of every family's life.